Hi.
Hi, Amal.
Hi, how are you? Can the attendees hear us?
Sorry,
Can everybody hear us? I can hear you quite well.
I can hear you as well.
Okay, perfect. Just making sure. All right,
Great.
let's start.
Sorry. Great. Wonderful. Sorry about the delay of technical issues.
These things always happen.
Yep. Now, thank goodness we got in now, so that's good.
So, hello everyone. Thank you very much for attending. We're very honored. We've got more than 120 registrations from all around the world. Other people were not able to attend due to the time factor. However, this webinar is recorded, and we're going to share the link on our handles, so don't you worry about that aspect. We have certain questions that Simona and I went over and tried to group them so we can answer everything that we've got so far. We'll do our best to do that given the time factor. We also have a giveaway at the end. We're going to ask 2 questions, and the answers to those questions are going to be within the webinar. So you guys have to pay attention to be able to answer. For Simona, can you explain a little bit about the giveaway and the credit?
Sure. So Amal and I came together to give away a gift to the attendees, and each of us is going. So Hope is going to give a $300 credit for virtual or in-person services, and I am going to do the same. And Hope's is going to go to a parent, and mine is going to go to a therapist.
Yes. So let's start. We're going to first introduce ourselves and how we got to know each other. So we'll start by Simona.
Okay, great. Sorry, I just need to grab one thing here because I connected to my phone. So just to make sure that doesn't run out. Sorry. So yes, thank you very much for hosting this, Amal. I really am very honored, as you shared with the group here today. I'm very honored to be invited to participate. And I am Simona DeMarchi. I'm based here in Toronto, Canada. I have been a CME practitioner for 25 years to date, so my entire career, in fact. And I first came to know about CME through my final clinical placement when I was in university at the University of Toronto. I was very fortunate to work at a school here for children with developmental disabilities. And on my very first day of that placement, I met a little boy who was one of triplets who had a diagnosis of spastic quadriplegia. And my supervisor at the time was working with this child, and he walked into the therapy room, which to me as a student and just knowing a little bit about cerebral palsy at the time was amazing in itself. And then the therapist proceeded to do some very high level exercises with this child, and he was completing everything independently. And I think my jaw was on the floor the entire session. And I managed to speak with his mom at the end of the day, and she really attributed his progress to this therapy. So that turned my whole career around, and I began to pursue CME and haven't ever looked back. I love it very much.
And when did you get to meet Ramon?
So I met Ramon right upon graduation, actually in 1997, and I did my introductory medic course at that point. I did that in Monroe, New York, in a small little town in New York State, and that's the first time I met him. Well, the first official time. And as I shared with Amal, if anybody's interested in this little bit of a story, I won't share it today, but it's on for anybody who's on Instagram, it's in my Instagram page. That Ramon and I actually met before we officially met. We didn't even know each other at the time, and we managed to cross paths here in Toronto in a very unexpected way, and didn't realize until after we really did meet that we had actually shared this connection even prior to that time. So it was pretty special, and I really feel it was destiny for him and I to meet.
Very true. Very, very true. I'm going to introduce myself briefly. I'm Amal. I'm a computer scientist by profession. I'm a mom of 3 children. My 3rd child has cerebral palsy and was given very poor prognosis at birth. And hence, I decided to take her and go discover what treatment options are out there to try to help her and give her the best possible potential. So that trip that we took in total 2.5 years of going and trying everything from experimental treatments to everything, Anapanyel, Mosgotova, suit therapy, spider cage, you name it, we tried. until in one of the times I was doing an intensive in Poland, and I met an Italian mom who's still a friend of mine, and she said, why don't you go and try CME? Your child is very young. Mine is 17 now, so it might be too late for me. And I was like, what's CME? She said, Cuevas Medek Exercises. And then I remembered the word medic that I heard again from a mom in England while I was going there, that she's doing medic therapy. And I started Googling, and one of the French moms that I became friends with offered me her slot in France because therapists are always fully booked. I went and I tried this therapy, and I was just blown away, and I never looked back. And I was fortunate enough to go to Chile, work with Ramon. And on the last day of this trip, I took a promise that I want to offer this therapy in this part of the world, the Middle East, where I come from. And that's why I founded Hope in 2017. And the inspiration behind this was to offer CME in this part of the world. And in January 2022, we offered the first CME level 1 for therapists. And hopefully we're going to offer a CME level 1 again in July. So that's one mission for me fulfilled. I'm going to go over the questions that we got and regrouped. And if Simona, you can give us a little bit of insights around this. So many people ask therapists and parents, who is fit for CME?
So generally we say children with either a diagnosis or even a concern. So for example, a child that's born premature that perhaps is going through the diagnostic process. At that point, parents have expressed concern to their medical practitioner that they, based on birth history and based on how their child is developing, that there might be a developmental concern for their baby or child. And they can access the therapy at that point. So very common children sort of diagnoses that we work with, certainly children with cerebral palsy, genetic conditions, epilepsy, different forms of seizures, and then just sort of the global developmental delay. Here in North America, when a child is going through perhaps a diagnostic process, physicians will put a title of global developmental delay if there's a developmental challenge in more than one area. And that kind of just encapsulates, and then maybe later on they might get, for example, a diagnosis of cerebral palsy after the testing has been done. So any of those families can access CME. And encompassed in that question is really, who is it not appropriate for? So one population of children that we say definitely CME is not appropriate for are people with osteogenesis imperfecta, which is a condition that weakens the bones and puts those children very much at risk of fracture. So just based on the weight-bearing nature of this therapy, that is certainly a contraindication. Also, definitely a situation where it's a proceed with caution, I say, is things that are conditions that could be neurodegenerative. So the reason I say it's not an absolute contraindication is that sometimes I personally had children with a diagnosis of global developmental delay who the parents don't know yet, the diagnosis hasn't been made, and we, in the course of therapy, I might be identifying with the parents that there is a decline in the child's function, that I'm seeing a change in the responses, and it's going in a negative direction that we are getting concerned. And that would be a reason for me, for example, to say to the parents, yes, I think, we need to maybe stop therapy at this point, and you need to look into more diagnostic procedures for your child, because there's definitely a concern that there could be something neurodegenerative of nature. So that would be another caution. And the other one that a lot of people ask me about is seizures. I mentioned that we do work with children with infantile spasms, diagnosis of epilepsy, various different kinds of seizures. That is also a population of kids that I would say we proceed with caution. And that is really something that I advise when I'm teaching the therapists in the courses, that they ask questions. When we're taking the medical history, we really need to know, is there a history of seizures for this child? If so, are they controlled at this point? Are they still actively having seizures? What do the seizures present like? What are the medications or treatments that are in place? Because we need to be educated. There are certain pharmaceuticals, for example, that can carry certain side effects. So we need to know if those are in place so that we can manage the care for those the child properly and safely. But seizures in and of themselves are not a contraindication to doing CME. It's a proceed with caution, be very mindful, put spotting in place, of course, if a child has a seizure in the middle of an exercise. That's something we need to be very alert. So you need to know what they look like and how the child presents with their seizures.
It's very interesting that you explained about how you have to be mindful, because we got a lot of questions with regards to level of therapists. What are they a reflection of? Is it a reflection of the number of exercises they know, their skill set, the challenging exercise that they can perform, or how do you see that?
Yeah. So just so everybody sort of understands the educational program in CME, you need to understand the levels first of all. So there are levels 1 through 4 at the present time. 1 is considered the introductory program. 2 is the intermediate. 3 is advanced certification in CME, and 4 is the instructors, which I achieved in 2009. So I've been an instructor for 13 years now. And yes, it's sort of a multi-level question, a very good one, because certainly when you're starting off in CME 1, for example, you potentially, most of the time the therapists have heard about CME. A parent may have shared an experience, or they may have had a family that traveled for CME and then come back and they see these incredible changes and the parents are excited, and that sort of spurs them to go on and find out more information. So when they come into CME at that stage, they're very new. They haven't had the opportunity to handle children in this way. And one of the principles of the therapy is that distal support. We use distal support, which basically means that we're holding the child as little as possible. And that requires a certain amount of experience and dexterity to develop the ability to control a child that may have very little motor control using that distal point of contact. So in level 1, they are considered, again, introductory exercises. When a therapist, if they decide they enjoy the program, they might decide to pursue level 2. And certainly the exercises do increase in complexity a little bit, but not everything. I always say that CME is not linear. It's a circle. So as a therapist, we have a circle. Everybody's circle is different based on your experience and your years of practice, I guess. And we're standing in the middle of the circle. And I just pick, as does Ramon, as do a lot of other practitioners. We just choose in the moment with the child in our hands what we feel would be most beneficial for them. And sometimes it could be a very basic exercise. Sometimes it could be a very advanced exercise. So it really depends on that moment, that particular day, how the child is working that in that session. And I think the other thing for me is that I did my courses over 12 years. So that's a long time. That, not that it has to be that way. It was just the way my life worked out. And I really do think that it allowed me a lot of time. It allowed me time to really absorb the teaching that I did. And I did all of mine with Ramon directly. And really to absorb the lessons, the approach, how he speaks with parents, how he interacts with the children, the connection that he builds in his sessions with everybody in the room. So that's not something that can be rushed, and it doesn't necessarily mean that just because, and I'm not saying anything about anybody that has CME3, for example, but just because a therapist has CME3, you could have a level 2 practitioner who's done a lot of mentorship, that's just spent time with a therapist and been in the room and observed a lot, versus a level 3 person that did their course and never went and did any other mentorship or continuing education. So there's a lot of, it's not a very straight answer, I realize, because it isn't a linear situation. It really is something where parents need to ask questions of their practitioner, ask who they did their certification with, how much mentorship they've done in between their courses, and really delve in and see if that therapeutic connection can be made between therapist, child, and family.
Yeah, true. We received, I would say, around 30 to 40 questions just about intensives.
Okay.
What are intensives? How long should intensives be? Who could do intensives? Can you repeat exercises in an intensive? How many intensives can I do a year? Those are the families. Also the therapist, can I be a level 2 and do an intensive? Can I be a level 3 and do an intensive? How many exercises should I know to do an intensive? So can you give us a little bit, what's your take on intensives and for therapists and as well as for families?
Okay, so excellent questions. Really, I think the intensive model is very, very popular. And as I said, I've been a therapist for quite a long time now. So I've seen things kind of ebb and flow and come and go in popularity, and certainly intensive therapy. And I think it's here to stay because it is a concept that works very, very well. I've always said with Ramon, for example, when a family travels to Chile, as you know yourself, Amal, with Dara, that if you're there for 2, 3, 4 weeks, let's say, you're doing 2 sessions per day, Monday to Friday, in his hands. I would do that in a year with a child once a week here in Toronto if I was seeing a local family once a week, for example. So definitely it is a very widely used form of techniques or a very widely used approach with various techniques. With CME specifically, the way I approach it, and I know Ramon feels this way as well, that it's not the hours necessarily that the child is in the center. So it's not that they are here for 2 or 3 hours, for example. It's the variety of provocation, the variety of stimulation that you are providing as the therapist to that child. So somebody who is CME1 course has 41 exercises in it, plus extra ones that we would show depending on, what the approach of the course is. The children that are there, they get opportunities to see other exercises. But it's not a very big grouping of exercises that they're seeing at level 1. So they would end up, if they were to offer an intensive at that stage, they would end up repeating a lot of things because they simply don't have that big wide circle that I was talking about earlier. And for that reason, we really advocate that level 3 and up should be providing intensive CME therapy, because at level 3, there's a requirement that you need to spend a certain amount of time in mentorship. So you've experienced a lot. You've handled kids with your supervisors in their sessions. You're getting exposed to a lot of different children. You've done a lot of clinical observation at that point. So you have that capability of offering intensive CME. However, because I'm here in North America and I have a lot of therapists that come to me for certification in CME 1 and 2, and intensives are very, very popular here in the centers, what I suggest to these therapists that if your facility offers intensive therapy and you have occupational therapy, speech therapy, traditional PT, and CME is one of your offerings, you explain to that family that CME is going to be, for example, if the child is in the center for 3 hours per day, Mom and Dad, I'm going to do CME for one of your child's hours is going to be CME therapy, because whatever you feel it's clinically appropriate for that child and would be beneficial to them. And the other 2 hours, they're going to do their traditional, whatever, their PT, their OT, their speech therapy, hydrotherapy, whatever the other techniques are. But you're not saying to that parent, I am offering you intensive CME. CME becomes a component of the child's intensive program. If you're 1 or 2, when you're really capable of saying, I offer intensive CME therapy, we really feel you need to be CME 3 and up, because that is the variety, again, the variety of exercises that we are exposing that brain to in a given session during the day. So,
how long should an intensive block be for a family? A minimum of how long?
So minimum of a week, and I can speak for my practice anyway, a minimum of 1 week, and I do a maximum of 4 weeks. So anywhere, and I would say a lot of families now, obviously the pandemic has changed things a little bit. So now I would say I have more of a week because there are local families that are traveling maybe a short distance by car. Certainly when the travel is further, then very commonly would be 2 to 3 weeks, I would say. And some families, when they're traveling a great distance, might stay up to the 4 weeks. After that, I really feel like the child also needs time to consolidate. Nobody goes to the gym, nobody exercises at that level every single day, on and on. Well, maybe Olympic athletes, but even them, high level athletes take breaks, and you need time for your body and your brain to consolidate and to apply what the provocation that's being provided in that intensive therapy in your day-to-day life. And also families need to be a family. I'm a real advocate for, it can't always be, therapy needs to be in place. It needs to be of high quality when we are engaged in it. And then there needs to be time for breaks and rest also.
Yes. Repeating exercises. Is it sometimes a high level therapist, like a level 3 or a level 4, would repeat exercises, or not in one intensive block?
No, there will be moments where we may come back to things because we're evaluating a child's response. I might do something early on in the intensive therapy block and then revisit it later on, the subsequent weeks, because I want to see if there's a change. I'm not here to say that we never, like every single exercise is different in every intensive block. It's also very much dependent on the child's response, because we talk about something called the recovery potential. The recovery potential is basically the potential of that brain to respond to intervention. So we all know that some children have more severe level of damage to their nervous system and their brain. Other children have a lesser degree. So it really is driven by a child that has more delay, may have come to the therapy a little bit later, like your friend suggested, when you started and you first met, Dara was just a year old at that time versus her child was 17. So it's a very different, there are certain factors that impact also what we can do. Obviously, it's going to be very different with a 7-year-old child than it would be with a 10-month-old baby. So I don't want to give the impression that repeating is a wrong approach. However, you need to have access to a big circle to really know the clinical decision making as to why you are choosing each exercise, how it is addressing the specific goals that you and the parents are working towards with that child, and really to understand and appreciate the nuances of the handling that's involved in CME.
Challenging exercises. So many parents were saying that they judge how good the therapist is by the number of challenging exercises they do. And if the therapist goes to basic exercises, they feel that it's a waste of time, might not be indicated. And we received a lot about challenging exercises, that parents want the whole intensive block to be challenging exercises where they would see more moments of failure in the response than the child actually responding. What do you think?
So and I'd like for you to share your experience, because we chatted about this aspect, and you have a great insight having been through this with Dara. But as I was sharing, I once had a family that came to me from another facility where very challenging. And if people have seen a little bit about CME, you've probably seen, for example, aerial sitting and the floating in palms and the floating on the bar where the children are standing without support. And it's an incredible therapy, and it pushes the brain to a wonderful level when the child is capable of doing those things. And this particular family that had come to me, as I said, had come, and their experience was these very high level exercises. However, when I evaluated their child, I found it was a little girl. Her trunk was like this. So she was standing by thighs, for example, and the trunk was completely collapsing forward. So I explained to her mom that, listen, I'm going to pull your child back a little bit. I'm going to go back because she had been working on the floor. I'm going to go back to the table. I feel like some foundational aspects have been missed, and this is what I want. I want to be down by thighs. I want to be by ankles. I want to be standing her in palms, but I want her trunk to be properly aligned. And I spent the whole first week of the block doing very basic, the kneeling by standing, simple exercises, even things from CME 1, which people would think, oh, that's very basic. But that's what the child needed. And at the second week, I had her standing by ankles, doing freestanding in palms. Trunk was perfect. Mom came in with tears streaming down her face, and she said, Simona, I wasn't sure. When I first came the first week, I wasn't sure. I thought, I'm not sure if I made the right move traveling to come and see you. I'd had this experience of these very high level exercises, and here I am putting my child in a CME4 therapist's hands, and I thought you were going to be, keeping on jumping. And I didn't. I took her back. And she said, now I see it. Now I see the benefit. This second week, the aha moment happened, and she really saw. And then we could do those things. We got aerial standing also, and her daughter did beautifully, but that foundation needed to be built. So Again, Amal, it is really, for everybody who's listening, it is really a matter of clinical decision making. It's not just shooting at exercises, right? It has to be really thinking. And I'm just going to share, because I've learned so many incredible and amazing, I'm going to try not to cry, lessons from Ramon over the years. And one of them, he said to me one day, he was working with a child and he did something, can't even remember what it was. And I looked at him and I said, oh, Ramon, how did you come up with that? Like, I was thinking of something totally different. And he looked at me and he said, Simonita, I have a librarian in my brain. And when I'm working with a child, the librarian, I'm doing one exercise and the librarian sends me the next one. And I don't think really, and sometimes he stops and thinks, but really he says a lot of times it's just my experience, the hands, my feeling. And I looked at him and I think I did cry at the moment. And I said, Ramon, when am I going to have that feeling? And I have to say, I have it now. I really do. The last few years, I really feel like I have that librarian, and it's different than his. I wish, I could extract his librarian. But I have my own experience. I have the kids that have taught me over the years, the lessons that I've learned from the children and the parents. And I really do now explain in my courses, listen, I say guys or therapists, I'm here and this is why I'm doing this particular exercise, and look at the child's knees, look at their pronation, look at their knee extension, look at the position of their head. So this is why I'm choosing this exercise. It's not just about the configuration of the boxes and where I'm holding the child. It's about understanding really why you are making that choice for that child in that particular moment.
Yes, I feel the same, because I worked with many CME therapists. And a lot of the times that I felt that this is not the right alignment, and Dara is actually suffering more than she's benefiting. Until I worked with Leo one time and he said, we go back, we cannot have this. We're exaggerating the dystonia. You're not going to see me doing what you think is challenging exercises. I don't want you to hate me for it, but that's what she needed. And at the end of that intensive, she was totally different. Involuntary movement was far less. And I understood at this moment, it's about understanding which exercise to pick. It's understanding the child. So CME does not cause bad alignment as many people think, or it does not just get them standing regardless. The therapist needs to understand the child and act accordingly and stimulate them to the level that they can. And we needed to go back. So as you were saying about the child, Dara needed to go back. So we were not doing aerial or that beautiful exercise that you want to see. But then again, the response was amazing. Like, I see exactly what you mean.
And that's the thing, we can't, also the number of exercises, that one gets me sometimes, where people say, well, this therapist did only 4 or 5 things in a 45-minute session, and that one did 12. That is not, like, if you're doing 4 or 5 things, but they are highly effective, and you're doing 12 that you're eating, not eating, but going through exercise, cycling through exercises really quickly because the child's not able to respond. That is not, like, it's not just it's the classic quality over quantity. Okay. It's really about really understanding and selecting carefully exercises that the child is just the right level. We're not making it, because one of the principles of CME is that we are provoking new motor responses or things that are difficult for the child. So we want to be hitting that. I knock on the door of challenge. I just give a little tap. And then if it's too much, you pull back a little bit. But you always want to be sort of pushing that envelope so things do, provoke and challenge the child, but not to the point that we're sacrificing alignment through their body and creating tone patterns that are too challenging for them.
Exactly. Okay, so mixing. A lot of people asked about their children doing various kind of therapies, like they would do intensives where, as you said, they would couple CME with other things, or they would work in, like, put orthotics on, use a walker, and they're doing CME. What do you think?
So I will say, because I did say the experience, because again, taking one step back, when I talked earlier about intensive therapy, intensive CME versus intensive therapy blocks of just other like multidisciplinary teams, for example. I'm just also trying, we really want to make opportunities available for CME practitioners. Okay, I'm not here, I say to the therapists in my courses, I am not here to limit you. You are professionals. You are going to make your clinical decisions. This is how we present things in CME. And with respect to therapists that might come to CME with other NDT, TheraSuit, other courses in their tool bag, shall we say, I say, you know what, guys, when you leave the course, if this really resonated with you, and for the most part, most of them leave on the last day and they're like, Simona, it was amazing. Like you just totally seen the kids and it just totally opened up my whole eyes to a new possibility. And I say, okay, leave the course and dedicate yourself. If you see a child, for example, 3 times per week, I am going to do 3 or 4 weeks of just CME with this child, and then see if you see the changes. Do you see things connecting? Do you see changes you didn't see before in this child? Are the parents reporting changes at home day to day when the child is moving around in their own environment? Those are the things that then will spur you to say, wow, this really does, it is making a connection. And I really am. And it's amazing to me, even in the pandemic and the difficulty we're all facing globally right now, and the introduction of the virtual courses, which Ramon gave, it was really tough to convince him that this should be a step we should take. We have people taking CME1, even in virtual format, and coming to me, writing to me saying, Simona, I was working with this child doing NDT or doing another type of therapy for years. And I did CME with them. I dedicated a period of time and the changes are incredible. So that is where I think you really need to hone in, because if you mix a bunch of different techniques together, you're not going to know what is really resonating with that child and if they are responding to CME. So I advise people to just take a block of time. If it works for you, great. If it doesn't, then you can make your decisions accordingly. I was inspired from day one, and I just have never, I did do courses and other things. So I did take some introductory NDT, I did some other treatment techniques, but CME was always what I came back to, because it just produced a sense of professional satisfaction for me that was far above anything else I had experienced. So
from a parent's perspective, because I worked with CME practitioners who would let me go on, let Dara not wear shoes or use the AFOs. I would also say, you keep doing what you're doing, but if you're doing CME in this session, just stick to pure CME, like do it properly with no AFOs, with shoes, and then in the other techniques, do whatever you're doing. But it just doesn't make sense to offer CME, and I think it's unfair for the families, because a lot of people do this. You offer CME along with AFOs or with no shoes, stepping on the box. I was one of the parents that experienced this, and I didn't know that this is wrong, and I needed to ask, and I needed to write to Ramon and ask, like, is this something new? Is it allowed? Does it make sense? So in the CME session, it needs to be purely CME, because that's what the families came for, right?
Yep. And in fact, I'm going to show, because this is something I hone in on the courses when I'm teaching. Even my doll has shoes on. Okay, so absolutely. One thing I'm just going to say for any families or therapists that are listening today, CME, when we are working in standing with the children, and in particular, absolutely, when you are working on the boxes, on the wooden materials, you can see some of it there behind me, shoes. Okay, there is absolutely, it is unsafe to work without shoes on, because the child, it's made out of, the materials are made out of wood. There can be little splinters. Some of mine are as old as I've been practicing. So just from banging them together, use over the years, they will possibly develop that. So you need to be very careful. And beautiful smooth skin on the boxes, the kids can slip, and it's could be painful also, which I think you were sharing the experience that Dara had. So absolutely shoes, and these happen to be an orthopedic type of shoe that's on my doll, but it doesn't need to be anything. And certainly that's something that's, again, specific to each child and discussed with the parents. But where we're talking orthotics, so that is an orthopedic type of shoe that's just purchased from an orthotist, or there are some companies that do it, even that offer that service online. Those are just giving a little bit of support to the ankle while we are working. And they also have, generally the orthopedic type shoes have a very good thick sole on them. So they're very good for the boxes because they give a little bit of grip so that the child is safe. When we are talking an orthotic device such as an ankle foot orthosis or an SMO, for example, a submalleolar orthosis, or even things like Theratogs and Spios, different suits, different things that we can put on the children as therapists. Certainly those have a place, but in CME, another principle is that we are exposing the child to the influence of gravity using that distal support that I referred to earlier. So when you are exposing the brain to the influence of gravity, that needs to be done without those additional pieces of equipment on. We really want the kids to feel as much as possible where their ankles are, where their trunk is, where, even as basic as head control. So we need the child to feel all of that freedom in order to respond maximally to CME and to really see if CME is a match for that child.
Yes, for sure.
And one other thing, sorry, I forgot to mention because somebody had asked about walkers. That is also something that again, I do just CME at my practice. So if I have a family that comes to me whose child is using a walker, because it's very common, the kids that come to me often go to large children treatment centers here. They might be in school. They might have a physiotherapist that's working with them in the community. And that piece of equipment might already be in place. If I see that there is potential for that child, which obviously if they're in my hands, I'm working with a family where I feel that there's potential, I will say to the parents, you know what, Mom and Dad, can we just give me 6 months, put the walker aside and let's see what we can do. The reason for that is because, as you know with Dara, Amal, when we are trying to get trunk extension, for example, if the child is then going home or going to school and putting weight through their hands and using the walker and in this forward posture, it's kind of counteracting what we're trying to do in therapy. So they're coming to me and I'm saying, okay, take your hands off of everything and I'm going to hold you as low down as I can. And then they go to school and they go home and they're in the support. So their brain is getting mixed messages. And if we really are trying to get some progress in response to CME, which obviously is our goal of doing therapy, that is not an ideal situation for the child to be experiencing.
Yes, very true. We got a lot of questions about discharge, and this was very heartwarming because barely you would see family being discharged that much, but they are worried that they were told that they are okay, they need to go practice sports, or no more CME for them. So when did you do that?
So again, very much child driven. In a child that, for example, would achieve independent walking, for example, we have certain markers that we look for. So for example, one of them is that the child should be able to go up and down the low box in the CME set, which is 4 inches or 10 centimeters in height. They should be able to go up and down that independently. They should be able to step in and out independently. And they can cross the wobble board material that we have in the set. And also there's a balance beam that we try to achieve, which is more for tandem stepping. So all of those skills we look for as markers in CME because, for example, you can encounter stairs in the environment. You want to go to the park, you're going to get uneven surfaces. You go to the beach, you might be walking on sand or in grass or different obstacles that the child can encounter in their day-to-day life. And we know, for example, if they could step in and out the box 10, they have enough we call it single leg stance in therapy terms. They can put enough weight on one foot, clear their other foot, have balance to shift their weight, land that foot and safely get in that target and out of that target without falling. So there are certain markers that we look for before we say, okay, you can, move on. And I, in fact, had one family that when I did all the markers and I said, okay, he's done. And the mother looked at me and she's like, no, Simona, he can't be done. I need to keep coming. You have to find something else to work on. He's not jumping. And I said, okay, Cora, we'll keep working for another little bit. We're going to work on the jumping. And then he was able to achieve that. And I said, well, you know what? He really, he's like, we've achieved is capable for me to do here with CME. And this little boy also had communication challenges and other things that he needed to work on. So I said, you know what, you're really, and she's like, oh, but we've been with you for so long. And I said, I know it's hard. It's very hard for me also, but it's a beautiful reason to part ways. And I always say I leave a little print of me with every child that's around that's, progressed on from CME with me. And it's a wonderful, it's a bit sad, but a happy sad. And she in fact called me months later and said, he's climbing on everything and doing, and I said, yeah, well, don't blame me, because you knew what you signed up for.
Yeah,
And she's like, oh, it's wonderful. But so that's one scenario where we would, maybe discharge a child. Another one can honestly be if we mutually, parents and myself, we get to the point where I feel a child is not responding. I'm not able to build that consistent response to the therapy that I'm offering. And that is a difficult situation. And I've been in it myself personally, where I have to talk to that family and say, listen, this is what we're working on. I am not able to get a consistent response in this particular area of development for your child, which is required for me to continue to move on and get to the next stage. And sometimes is it a factor of maybe we missed a few sessions because the child fell ill, or maybe they just haven't, something's been going on that's disrupted the we call a trial period. That's another principle of CME, is that we suggest a trial period at the beginning, because not every child will respond. We have never sat here and said CME is the be all and end all for every child. Ramon, in fact, will share, 25%, I do my best. And brain is not, that recovery potential isn't there, and the child isn't able to respond to the way we would hope. So I think that's it's just an ethical, it's a very responsible thing to have that conversation. And it is a very difficult conversation to have with parents, because oftentimes they come to CME excited and with hope, and, we do our best, and that connection isn't there for whatever reason. So I feel that's my responsibility to the clients that I work with, to the families that entrust me with this role in their child's life, to be very forthright. And if I'm concerned, the parents know. So.
Yeah, I think that's very important, because many families do not know that CME might not be the right fit for you. And they think that a lot of CME practitioners will just keep working, keep trying to get response. But when I was personally working with Ramon, it was when I went to Chile, he said, we're going to try this, and then we're going to see, and I'm going to let you know if it is for your child or no. And that was surprising, because I have never went to a therapist or tried a therapy where somebody told me, I'm going to give you a decision if you can come and see me again, or no, it's not for you, which is very responsible and very ethical. And I think a lot of people are lacking this concept that it might not be for you.
Yeah, it's interesting that you share that, because I have a personal friend of mine whose daughter's story is out on the internet. It's quite a public, her daughter's name is Taya. And I asked her mom, Jeanette, at one point, I said, because I didn't know her at the point that I wasn't sort of part of the initial therapy when she first went to Ramon. And she said, you know what, Simona, I wrote him and I explained my daughter's diagnosis. And she said, I also wrote to the institute, to another facility, and that facility sent me a glossy brochure with a DVD of successes and different things, like a little bit of advertisement. And she said, and I write to Ramon, and he sends me back and he says, wow, difficult diagnosis. I'm here. And if you want to come, mommy, I'm here. I'll give you my best and we'll see what we can do. And she said, it really struck me that he didn't sell it to me. He didn't give me any promises of anything. He just said, difficult diagnosis, which she did, and she is walking independently. But it was a very, very challenging situation to work through therapy with her and with the family. And thank goodness they were able to achieve beautiful results with CME. But I think Ramon has always been just very quiet, that's, part of the challenge of why maybe people say CME is not out there as much, and why isn't the information there, because Ramon's really not about going on social media and, putting himself out there. He's really there just working in Chile, doing his thing for the families and the therapists that want to come and learn and work with him and experience a little bit of his magic.
I got a very beautiful question from a therapist asking. They've been hearing about CME, they want to do the course, and they want to hear your opinion, having been doing this for quite a long time. Why is CME different? Because that therapist is certified in everything you can think about. So NDT, Voita, everything. And he says that I've always felt this is what I need to do. Why is this different? And why is it that many people who go on level 1 and 2 and 3 never come back to the other techniques? So why is it different?
Response. In one word, the response. You get, like I said, me personally, and I can't speak to some of those therapies because I don't have personal experience with them, but the response that you get from the children, I can't even articulate it. I don't think. It's just when you feel a child in your hands and you see them making extension against gravity in a way that perhaps you didn't experience with other therapies, it provokes a sensation in us as well. And I really say this is absolutely an exchange of energy between myself or between any CME practitioner, the child, and the family. And if you don't develop that connection, the response won't happen. But if you see, you're here and you're watching a therapist working, you can see those connections just from sitting and observing even. And it really is an incredible thing that spurs us to go and continue to, for the most part, most people do come back and want to continue to learn. And in fact, now we're having the bit of, it's a beautiful challenge to have, but we're having a bit of a challenge with people really like, I want to learn more because it's so exciting, and CME 1 isn't enough for me. And when can I have people, messaging me all the time, when can I come for level 2? Because they want to go and move on, and they've felt that little bit of satisfaction, and then it just builds and builds and builds with more and more experience that you develop.
It reminded me when I read this question, because I got the exact same answer from Lisa Barrios and from Alyssa Parker, who they have never met. So Alyssa told me, what I achieve with CME, I cannot achieve with any other tool. So I feel like, why should I waste my time or the family's time practicing something where I know the result is going to be better if I focus on this? Lisa was also doing pediatric, and she said, what I achieve is unmatched. Why should I use a tool just because I spent years learning it if I know in this 45-minute session what I'll get out of this child by CME is unmatched? And again, it comes to experience. You said something very enlightening. If you're a level 1 and you've only come for the course, you will not have enough experience to give the child the best. So it's about continuous education. It's about learning more exercise. It's about knowing when to pick the right exercise as well. So I think it takes years for you to reach there.
Yeah, and it really does. And I think it's incredible to hear therapists, because my personal experience is I met Ramon straight out of the starting gate. So I did, and in fact, I credit him a lot with this also. I credit him with so many things for me, but this is a lesson he also gave to me early on. He said, Simona, I can see that you love my technique and you're really becoming passionate, and that's wonderful. Go take other courses. He actually pushed me out the door, and he said, go do other things. Don't just because you see me doing this or you hear parents, go make your own assessment. And I tell the therapist, because I get I get some more experienced therapists, but I also get a number of new graduates, and they come so mesmerized and so fresh, and it's so wonderful. But I say to them, you took the course with me. This is my approach. This is how I look at this child, but go learn other things and make your evaluation for yourself. And when you experience it, most people are like, this is incredible. And I think it's great that we have therapists such as Alyssa and Lisa, and I've had therapists with Ramon also, 20, 25 years of background of neurodevelopmental therapy, for example, coming to see me later in their career and it flipping them around at that stage, which I also think is incredible because they have all those years of clinical practice behind them and they see the change in the kids in their hands, even with level 1. So it's really, really great.
Yes, very true. We're running out of time, so we want to pose the questions, and we can take a little bit from the audience if we have time for this.
Sure, I have time. It's a topic I love to chat about, so I'm happy to say.
Very, very true. I love it too. So go ahead, pose your question first, and then the very first person that's going to answer in the chat will take the prize. So.
Okay, so my question is, when did I become CME4 certified? What year?
We got it. Deirdre McDermott is the very first one that said 2009.
You got it, Deirdre. Thank you. She's here in my city.
Okay, our question is, when was Hope AMC founded? There 2017.
We go.
Muhambil Natsian, you're the winner. So I think both of them can get in touch with us directly to take their credit.
I'll reach out to Deirdre.
And thank you very much for paying attention.
Yes, thank you.
Anybody wants to ask any quick question? We received a lot of questions, Simona. I'm not sure we'll be able to go through them, so maybe we'll have to go repeat. We have a lot of questions very specific to CME and the levels, the gap between the levels, clinical percentages, as Ramon called them, how many you need to do to get certain levels, DMI versus CME, a lot of questions. I don't think we'll be able to brush over every one of them. What do you think?
No, I think if it's of interest, I'm happy to do another chat. So as I said, I love talking about CME. So and I happen to be Italian, which is a combination in of itself that we are talkers to begin with. So I'd love to hop back on. And I'm also happy if there's any little short one that we want to address now. I'm happy to do that.
Yes. So anybody wants to ask any quick one, we said 30 minutes, it's an hour now. So I think it's 3 minutes to an hour. So anybody wants to ask a quick question? They'll type the question. I want to tell you about the video of Tia is how I first heard about you. I started Googling CME and then I saw the video that was done on the news for Tia. And then this is when I saw you talking about CME. Yeah,
with Lily and Taya. That was quite, it was a nice thing to be involved in. And Lily also did amazing. Yes. And I stay in touch. She's now 15, I think, if I'm not mistaken. I still stay in touch with her parents. So yeah, it's quite nice.
We got a question from a therapist. Have you ever dealt with a case with a progressive disease? If yes, after the child reaches a milestone, are we supposed to keep doing lower level exercises, such as trunk exercises, to make sure that the regression does not knock the child again? I would love to hear a clear answer about that.
So I think this is actually a mom, if I'm not mistaken, might have reached out to me earlier today as well. And certainly if I don't answer the question concisely enough here, because we're sort of tight on time, I will reach out directly as well. But as I said earlier, the progressive or neurodegenerative conditions, we do need to proceed with caution. However, in this particular case, if I'm not mistaken, that I'm linking the two contacts, this little one is standing by ankles, sounds to be doing quite well. So my rule of thumb is that if we are seeing signs of progress, we are not seeing a decline in the child's motor function, we can continue to work. It's when I see the signs of decline or deterioration of a response. So for example, if we had standing by ankles at one point and the child is beginning to struggle to keep the trunk in extension, to collapse in standing, having difficulty with knee control, that would be a sign that there could perhaps be something detrimental happening. And then we would obviously have to evaluate things. One thing I say also to the therapists in the courses with who is CME appropriate for, with the neurodegenerative or progressive conditions, we do need to be careful also because CME requires a great energy expenditure, okay, from the child and the therapist as well. So it is not a therapy. I think that's why it sort of provokes these beautiful responses in the children, but it does require a lot of energy output. And in those degenerative or progressive conditions, that energy expenditure can actually cause a child to regress more quickly. So it is a very specific situation that is unique to each child, and not one that I kind of feel I can give an overarching answer to, and something that requires a certain degree of experience to really evaluate, and lots of discussions with parents, of course, because you know your kids better than anybody. So,
but when also I was once working with Poliana, and there was a child doing the same intensive as we were, and she said, I'm not comfortable working with this child. I think this is not the right diagnosis. I feel the child walks out of the session very tired, and I don't think I'm the right therapist for you. I saw the family get mad, super mad. But then how beautiful is that? She didn't say, okay, you can go and try CME with someone else, but I don't think I can get to the child. So it's very child dependent and therapist dependent as well.
Absolutely. And I encourage, again, in the courses when I'm talking with a therapist, I say, listen, you know, this is what I did. If people sort of look and say, wow, how did you make through this journey? I sat on the floor literally for hundreds of hours, and believe me, as soon as I can get back to Chile, I'm back on a plane, because even since I achieved CME4, I've been to Chile 8 times. 8 of my 9 trips have been after CME4. So that's a real, I love it. You learn so much from just sitting and absorbing. And also, if you're in a situation where you have a family that you're struggling with, put them in the hands of somebody else that has more experience, and then go and learn from that person. I did that quite a bit with Ramon, where families that were working with me would, obviously tell them about him, and they would go and travel, and sometimes our trips coincided, and I would be there, and he would be right beside me. We'd be working together, and I'd say, listen, Ramon, I'm really struggling with this aspect, and okay, let's work through it and see if it's something. So just that mentorship piece really gives you a peace of mind, even for Pollyanna. Maybe, she's not saying, as you said, she's not saying CME isn't, it's just, I don't feel equipped to work to the maximum capability with your child. And I will make those referrals accordingly myself too. And if CME isn't the right therapy, I absolutely will connect parents with other facilities. And I'm fortunate to work in a city where we have access to a lot of different techniques, a lot of different practitioners of different types of therapies. And if I think something is better suited, I will discuss that with the parents.
We have another question. My son has Down syndrome, and we're planning to do CME in April. Dubai, I think in Dubai, she means. Right now, he can stand, but not independent standing. He's 14 months. Is it the right time? How many weeks should we do?
Absolutely. Sooner the better. So generally we say CME can be applied. That's not something I addressed earlier in terms of population. 2-3 months of age. Okay, 3 months we say usually with 3-month-old babies and up. And Ramona and I once chatted about this. We sort of evaluated the children that we've worked with Down syndrome. And when we start with babies about 4 or 5 months of age maximum, they are usually walking by the time they're 16 to 18, somewhere in that range, 16 to 18 months, which is still, especially now with the CDC guidelines being updated, still considered within quote unquote normal range for a child to walk. So certainly 14 months is a beautiful time to start. I would definitely get into CME at this stage. And that's something that whoever is working with your child will definitely be able to evaluate and see where the standing tolerance is. If the trunk is solid enough that the child can be standing by thighs, for example, or more distally, they will work through all of those aspects.
It's very interesting that you mentioned Down syndrome. So here in Dubai, because Hope is a medical center, we were once referred a very severe premature NG-fed Down syndrome child, and he was walking by 11 months just by doing CME, nothing else. And the number of referrals we're getting as soon as the children get diagnosed by Down syndrome, go do CME in Hope, go to CME in Hope. So we have got a very big population of Down syndrome, and they are respond beautifully. It's just unbelievable. He was walking 11 months, which is like early. That's if you're neurotypical, like
yeah. dosing sort of on the later range of normal, but that's incredible. Within it, that's even, you know, my kids didn't walk until they were 13 and 14 months. So, and it really is for children with Down syndrome. When we start the young, they get used, we put them in that upright vertical position at 5-6 months, little soft, according to obviously to their tolerance, but little bit of soft weight bearing to start getting that trunk and their body up vertical in space. It's incredible how quickly they can progress, and they do beautifully with the therapy. But that's not to discourage this family whose child is a little bit older. Still a beautiful age. 14 months is, you know, I find if we start with kids with Down syndrome, 2.5, 3, 4, they can be a little challenging because I try not to generalize, but it is certainly a population where they have a little bit of feist to them, and they can battle the handling a little bit when they get a bit more independent and a bit older. And they're physically bigger too, so that makes it a bit more complicated. But certainly I don't, and I guess that would be another point that's important for us to point out, Amal, is in terms of sort of, again, population, there is no, just to make this clear, there is no set weight limit for CME. So some people, in particular here in North America, I think there's been a little bit thing going around that at 50 pounds is sort of the cutoff. That is not set by CME by any stretch. That certain facilities may set parameters for their practitioners, for their therapists, and that is certainly an independent choice of theirs. But Ramon has never sort of put a maximum weight or a maximum age. What it is I say, if you feel the child will be safe, you can do something to help them, and you will be able to execute things safely, work. Okay,
Go on.
9. You could have a very physically big, heavier 3-year-old and a very lanky, slim, lighter 7-year-old. It really doesn't, it's not age, it's not a certain weight. It is, what is your child capable of doing at this stage? And do I think I can help him or her to achieve some motor progress, and what the parents' goals are, of course.
Exactly. We're getting more questions. I'll try to go over them and then we will see.
Yeah.
Okay. Which method do you use for problem behavior that prevent therapy? I think when you do challenging exercise and the child starts crying, what do you do?
Yep. So this is a good one also. So another of the principles, there are 8 of them. One of the principles of CME is that we do not require the child's cooperation or motivation to participate in therapy. Having said this, I really feel, and I'm going to give a little credit or a little memoriam to Ramon's son, Alexis, who, for anybody that knows a little bit of the history of CME, unfortunately, Alexis passed away almost 5 years ago now, and very unexpectedly. And Alex was, for many, many years, working alongside his father, and his professional background is child psychology. And in his experience, they were there working together, and there were obviously some children that were irritable, crying, irritated during sessions. And there was, when Alex told me the story, there was one child in particular where he said, you know, Father, why don't you just allow a little toy or something, some distraction? And I think Ramon sort of in the moment was like, okay, fine, do what you want kind of thing. And lo and behold, they engaged the child with a little bit of distraction, and the child calmed down. Ramon was there able to do his work, and it was much more effective. And the parents also were more relaxed, obviously, because when your child is upset, it's upsetting, distressing for the family as well. And the whole sort of environment changed in the room. And after Alex told me, after everybody had cleared and they were at the end of the day or just sitting in the office talking, Ramon kind of said, oh, you were right. Like, this is really, it was effective. It was a better way to do things. And I know Ramon in his earlier stage, when I first met him, he was very effective. But sometimes the kids were crying, sometimes they were irritable because they were being pushed. I don't feel not out of discomfort. It was, you're pushing me and I don't like this and I don't know how to tell you I don't like it. So the only way I can express myself is to get upset. And I have many pictures of him totally calm face, and the child is irritated. Okay, the child might be crying or something, and Ramon's there doing his job. Then I really feel like Alexis changed that course for CME, and is a beautiful contribution that he made to the therapy. that he really changed Ramon's outlook on this aspect, that now we do have little toys, for example, or the parents will bring some little thing for the child, nothing too heavy, just a little something for them to hold in their hand, and they'll talk about it, or they'll, you know, let's throw the Peppa Pig into the
yeah.
or a video or read a book or something, and we can still be incredibly effective, and everybody is a little more calmed and the energy in the room is very positive. So now I say I really saw the evolution myself going to Chile, and you go in now, Ramon, the first thing he does in the morning, he turns on some soft background music. You probably experienced this when you were there with some soft background music, and the parents will come in and it's good morning, you know, sometimes a little hug for everybody, and he introduces the therapists that are there, and it's such a beautiful, positive, you can't, I know, Amal, you know the feeling, you can't bottle it. It's like you just in this place where the parents and therapists don't even speak the same languages. We're from all over the world, yet we are all sitting on the floor there, just mesmerized by this child and what he or she is doing with this incredible, life-changing therapist
and everybody becomes friends at the end.
Yeah, it's incredible. You don't even, like, sometimes we can't even talk to each other, but we speak through CME, for sure.
Yes, very true. This is a very nice question. What are your suggestions to us young therapists who have started to practice CME therapy?
Mentorship. Really, that was what did it for me. I just, anytime I could, I called him. I said, I want to come. And he opened the door to me. And I was fortunate, I think. You know, some people, again, sort of reflect on my journey, and I've had people say to me, Simona, you're very lucky. And yes, I am very fortunate. One thing I think I am very fortunate is that I met Ramon when I did. I was sort of at the stage where he was traveling a lot. He was coming to North America, and there was a period of about 3 years where I think we saw each other every 3 or 4 months, because I was ping-ponging. He was in Toronto, Montreal, New York. I went to Chile. So we saw each other quite a bit. But that also, it was fortuitous in the timing. It is a lot of work. I will never say this therapy is easy. It is not. It's not easy for the kids. It's not easy for the families. It's a big investment of time, energy, and money. There's no doubt about that. So, and it is also very difficult for the therapist, but it is so rewarding. It is like, you just can't even, I have had many, I say, lots of tears, lots of sweat, lots of disappointment, lots of highs and lows in my career. I don't regret one single moment of it, because every stage of it taught me something. Yeah, it taught me, it made me into the therapist that I am.
Do you do the mentorship online? Because sometimes just traveling, it took me 46 hours to go to Chile. As a parent, that was like, 2 transits and delayed flights, 46 hours. So you arrive 2 days later. So can the mentorship be done online?
Yes. So for therapists that are a minimum of CME1 certified, obviously I can't provide mentorship. I mean, if a therapist comes and, you know, or does like, I want to just meet with you online for a conversation, if they're just exploring the courses, they're not sure if it's the right match for them, I'm happy to talk to them about that. But in terms of clinical mentorship, when you would be observing sessions, you must have a minimum of CME1 certification. And yeah, you can spend a day, you can spend a week, there's all different options. I am in the process of doing a new website. It's very slow because I have too many balls in the air, but it is going to be a part of my new website, all the services that I offer.
But I do think that the therapists that are asking here and asked before, you can get directly in touch with Simona asking about mentorship options, because I think that question is coming from a CME certified therapist as well. So they can get in touch with you for online mentorships.
Yeah. And I will say, you know this personally because you're working with Leo and doing the courses in person in Dubai, which is fantastic. And absolutely, I will say obviously I was all pre-pandemic, so I did all of my training in person, and it is the best way to do CME. Okay, there's no doubt about that. However, when the pandemic was about 4 months in, I started talking to Ramon, and I said, and he was like, no, Simona, listen, this is, as we all thought at the time, this is going to come to an end. We're going to go back, just take a waiting list. We'll be back at work shortly. And then 8 months started, and I said, Ramon, this isn't going anywhere. We need to come up, we need to come up with a solution. And it was driven by parents contacting me, literally some mothers crying, I can't travel to see you. I'm totally stuck. My child needs therapy. I want to continue. They were responding so beautifully. Please, what can we do? And I really went to Ramona and I said, listen, I went with a program in place, and he allowed me to start executing it. And now he is also teaching virtually, which is fantastic for anybody that wants to have an opportunity to experience some training and mentorship with him. That's an option. And it's really opened up. It isn't the best scenario because obviously you can't be here really experiencing it hands-on, but it is something during the pandemic with the travel restrictions and also just sometimes sheer distance like you've identified. It's opened up a new component for us for sure.
Very true. Very true. Thank you very much for all the questions. I think we will need to stop taking questions, and thank you very much for showing up and showing interest. And I'm sure we'll do this again and we'll take more of your questions. Any closing notes, Simona?
Just, again, like Amal said, thank you so much to everybody who attended. It's a very big honor. And anybody that has questions about CME, I am not admittedly the best by email. So if you send me something, bump it to the top of my inbox. People always say, I don't want to bother you. I'm like, no, bother me. It's good. It's good. Because then I know I need to get back to you. So yes, I just, it's not out of a lack of a desire or attention. It's just my treatment and teaching are my passions, and email is not so much a passion of mine, but I'm happy to be in touch with anybody that has further questions, and hopefully we can join again to do another chat. Great.
For sure. And thank you very much. It was lovely chatting to you and learning more, and we'll do that again.
Thank you so much, Amal, and then happy International Women's Day as well. I didn't realize that we didn't time it this way, but it's actually a very lovely and appropriate thing that we've joined.
Very true. Very true.
And same to all the mothers and therapists out there. Take care. Bye-bye.
Have a lovely day. Bye.
Bye-bye.
Bye.